Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A better life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
Hello, everyone. This is Dr. Taylor, and it's Wednesday, and that means it's time for the Ageless Blueprint. And I am the hormone doctor and the spiritual MD, and we are here to talk about how you can live an ageless life. And, you know, there's been a lot of information this week from the FDA and from the legislature in California talking about menopause and hormones. And they're talking about how there's so much controversy and residents don't know how to treat menopause. And I've been talking about this for almost 30 years, 25 years. And I'm joined today by a pharmacist who I've met over 20, 25 years ago when I was really into my speaking phase of my life, and is Dr. Mandi Romero. She actually collaborates with doctors. She's a pharmacist. She's been a pharmacist for 26 years, and she tries to educate doctors through her pharmacy, and she does that to try and deliver the best healthcare she can to the women that she serves. So she's not just a pharmacist, she's also a women's health advocate. And so I'm going to bring her on, and through her professional history and through her life story, she's somebody who can really relate to this audience. And we are here to try and educate the public so they can re-educate the physicians. We have just figured out that through years of trying to deal with doctors and trying to get them to change how they look at things, we have to go to the public. So let's bring up Dr. Mandi Romero. And hello.
Hi.
You know, we were backstage together, and I think I met you, I don't know, over 20 years ago.
Yes.
And I don't know if I've actually seen you face to face since then. We've spoken on, she's a member of our Ageless Blueprint community. We've been going back and forth. And with these issues that came out this week, I said, hey, let's do a podcast together. And so I'm going to be quiet. She's our guest. Just tell us a little bit about yourself and how you came to this point over the last 26 years.
Okay, so I started my journey as a pharmacist, working for a compounding pharmacy, and very successful compounding pharmacy. But our goal was to do hormone replacement therapy and menopause management. And so I was chosen to go out and go to conferences. I think I went to 2 conferences every year for 15 years. You were one of the speakers. That's how I met you at PCCA. Yeah. And so anyway, it took a long time to learn this. And I guess it's because we were pioneers, you know? Yeah. And so, but that's part of the story. So once I did my 15 years at the compounding pharmacy, in 2017, I had a total hysterectomy. I didn't think I would be one of those women, but, and you know, what's interesting is that I had to tell my doctor what I needed. So it was like, okay, let's take your ovaries out, and okay. And I'm like, wait, we're not done here. I need some hormones. And he's like, well, what do you want? So I know, and this is true, and he's learned from me, but he's still not there yet, but it's all good. At least I can get my hormones.
Yeah. You know, in one of my lectures, you know, Dr. Spiro, who I'm going to bring up here,
Yes.
who wrote the book, and in one of his talks, he says, because there's so much controversy, whatever the patient wants to do is the right decision.
Exactly.
I said, how can you say that? He actually wrote the book on GYN endocrinology. I'm going to bring up one of his slides. And I guess he just succumbs to the pressure of the pharmaceutical industry to say they just throw up their hands when it comes to women and menopause. And if you live long enough, 100% of women are going to have that issue. And how we can be so uneducated about it, it's really embarrassing for the medical community. I think it's embarrassing. So when you collaborate with pharmacists, I'm sorry, when you collaborate with doctors, what issues are you coming up against?
Oh, well, it depends on their level of
Yeah,
education.
right.
I have some that I met with personally, and I was able to explain myself and teach them what I've learned. And they were open. And they're like, "Hey, send me
Mhm.
the information, send me the recommendation, I'll sign it." Then I have
Yeah,
some that have written me letters and left me messages and said,
yeah,
"They're gonna have to come see me." And hey, I get it. I'm the pharmacist,
yeah,
you're the physician, but these patients are suffering. They are
yeah,
suffering and they are searching and they want their doctors to know. That's the thing. They want to go to their doctor and say, "Hey, what should I do?"
yeah,
And that's
yeah,
not what's always happening.
yeah. And you know what other issue can you think of that is like that? You know, nobody goes to the doctor and when their blood pressure is high, and the doctor says, "What medication do you want to take?" You know, I mean, 'cause you know, really, it's because you know why? Because with blood pressure, they have good data. That's the issue. With
Yes,
hormones, they don't have good data because they're looking in the wrong place. And if you've been to any of my podcasts, if you ever heard me say a word about menopause, I'm going to talk about proper testing methods. And if you don't have good data, you are going to guess. And most doctors guess. Now, I'll tell you another thing that we've learned and why it's so hard, Mandy, is that we are in this see one, do one, teach one kind of thing. So whatever you
mhm.
saw 30 years ago in my residency, most of those doctors are still doing it and they're still teaching it. And that's why nothing changes in medicine because the see one, do one, teach one philosophy. And I'm sure you come up with that. I mean, you know, come up against that also. Is they're
Yes.
doing what they were doing 25, 30 years ago. And you and I, we've been doing this for 25 years, and now we're right back at the same starting point.
I agree.
Mm.
I don't understand how these modalities that we've learned about have not hit big time.
Yeah. It,
Uh,
it's
it's
it's medical inertia. You know, that's all I know. So tell me what you do. I know you have a practice where you actually see women. So tell me
Yes, I do.
how that works.
So honestly, Dr. Taylor, I don't advertise.
Hmm.
Okay. They find me. I'm a mother. I have 3 children, busy life, but I make time for this because it's fulfilling to me. So when they find me, I ask them, "Who's your doctor? Who can we
Hmm.
collaborate with?" Because I'm a pharmacist, I have to collaborate. So basically, I meet with the patient after they fill out a medical evaluation form and
Hmm.
they do a saliva test. Now, if they come in and they have blood work, I will go over it with them, explain it to them. But ultimately, saliva testing is what I use. And once I
Yeah.
get all the data and all
Hmm.
the symptoms and all the history, I send a letter to the physician. I send them what I'm recommending, and I ask
Right.
them to collaborate with me. And they'll
Yeah.
prescribe it 70% of the time. But a lot of times it takes the patient going to the office and saying, "Doc, I need this. Please help me." And
Yeah.
so, and sometimes they just don't get it. But
Yeah.
most of the time they are agreeable.
Yeah. And that's why I say we've got to go to the public. That's why I'm doing a podcast. That's why I'm on Instagram. That's why I'm on Facebook. We have got to go to the public. The
Yes.
pharmaceutical industry, they understand human psychology. When they have a commercial, the last thing they say is ask your doctor about prescribing this drug, because they know if it's enough patient pressure, the doctor will just he'll do it just to get the person out of their office. So so
Yep.
that's the right strategy, and that's what we're advocating now. I think I've recruited Mandy to be on this. We're on this motivational
Yep.
experience to say, hey, patients, we need you. Another thing, if you remember, Mandy, I used to always say it's twice as hard to unlearn as it is to learn.
Yep. Yep.
And thank God the patients haven't learned the foolishness that I was taught even in an OBGYN residency. And I just got to mention this, and I
Mhm.
know it's still being done, because I was a resident at Emory University for 4 years, and we never ever drew blood levels on patients to look at their hormones because of this. I'm going to show you this slide. Can we put up this
It,
slide right here? Um, no, the on the second set of slides. So why didn't we measure hormones? Now, this is Dr. Spiroff. He wrote the book on GYN endocrinology. I did I still have a lecture called Hormone Replacement by the Book, where I only take quotes out of the endocrinology book. And it says this about serum measurement of steroid hormones. This is why Mandy doesn't draw blood. You're unable to easily distinguish between bound and free estrogen and testosterone. So estrogen is carried around, I call it a FedEx truck. So it's carried around in the bloodstream on a FedEx truck, but you can't do anything to the estrogen with the estrogen until it gets off the truck. And that's the free estrogen, and it goes directly into the cell. So whatever you're measuring in the blood is just a bunch of estrogen on a FedEx truck. It has nothing to do with what's going on in your body. And that's why it has such a large normal range. If you look at the blood levels, Mandy, they're like anywhere from, if you look at estrogen, I don't know what it's like, from 0 to 200 or something. There's some huge range. But this is the key. It provides limited clinically useful information. So it's information that you can't use clinically. And I see so many people on Instagram and all of these talking about blood levels and pellets, and it's the textbook says it doesn't mean anything. And still now residents aren't drawing blood levels because of this. So you're left to just guess. And that's what most people do.
I think they don't know how to order the labs. You
It,
would not believe the stuff I see. I mean, they order an
yeah,
FSH, an LH. Where's the estrogen?
uh,
Where at least we need to order that.
yeah.
And then I will tell
Mhm.
you, the one thing is when a woman is cycling, they just tell them go to the lab. Well, we don't even
Yeah,
know when what part of the cycle they're
I know.
in. So you
I
can't
know.
interpret it even if you were trying.
Trying to. I know. It's
Yeah.
uninterpretable. Now,
Yeah.
here's what I'll tell you what the trick is, you guys. So if you're menopausal, the blood tells you what estrogen or what hormone is coming from the ovary.
Mhm.
Okay. So in premenopause, it looks like everything's fine because the FedEx trucks are full, but you don't know how many packages are dropped off. And if you drop off uneven packages of estrogen and progesterone, you're going to be out of balance. Okay. So it doesn't work. Now, so premenopausally, you have a problem. If you have heavy bleeding, you have endometriosis, whatever. If you look at the blood, it's not going to show you that there's a problem. It's going to be normal. That's why you walk out of there so frustrated with a big 10-centimeter fibroid and they tell you your hormones are okay. Am I right or am I wrong,
Oh
Mandy?
no, you are 100% right.
Yeah, yeah. And
Except
so postmenopausally, what happens? Your ovary stops making estrogen. Then they say you have no estrogen, but they don't understand that your fat tissue can convert male hormones, androstenedione and testosterone into estrogen. That is God's way of making sure women can stay women, even though they go through menopause. They have a backup system in their fat tissue. So, but you don't see that in the blood, but you can see it in the saliva.
yes.
That is the key. And that's all to it. And how hard is it to do a saliva test? You can take
It's
it home.
so
Uh,
easy.
Yeah. So I'm sorry, go ahead. It's
No,
easy to do.
it's just so easy. And you know what I love about it is that we got all the hormones on the panel in addition
Yeah,
to cortisol. And and
exactly.
and it's not just about estrogen, progesterone, testosterone. We have to look at the whole picture. And
Yeah.
you know that as well as I do. I learned that from you.
Yeah. Cortisol, and I learned it late. Being an OBGYN, I was focused on estrogen, progesterone, and testosterone initially. But going to conferences like PCCA, let's talk about what PCCA is before I start. So, how we met, tell them what PCCA is.
PCCA stands for Professional Compounding Centers of America. And in my
Mhm.
opinion, they are superior. They brought compounding back. Okay.
Yeah.
And compounding is the art of making medication that may not be available. Okay. Now it still
Mhm.
has to be, a drug that's approved by the FDA.
Right.
We use products or chemicals or hormones that are USP grade. So what that means is, if you go to the regular pharmacy and you get estradiol tablets, it's estradiol USP. The pharmacy has an obligation to use the same thing. So it is essentially the same thing. It's
Mhm.
just not in a form that's available in mainstream. And so PCCA is the company that we purchase the approved drugs from. And they provide support in many ways. And like one of them is educating physicians and practitioners and pharmacists. And
Yeah.
so they do lots of things and they've done a wonderful job.
Yeah.
Wonderful.
And kind of tell them the controversy between compounding pharmacy and big pharma.
Oh, well, there's a lot. I think the thing is that, we're up against the big dogs, right? And they are, you know, products that are revolutionary, new stuff and all this. But the compounded products, I mean, like in a compounding pharmacy, you have to have instruments that measure proper dose, amounts. And
Mhm.
you have to have all this equipment and then it has to be tested. Like when we make a cream, they have to batch test this stuff to make sure it says what it does. But the pharma industry, they're,
Yeah.
I guess, more involved with the FDA and all of that. And but we're a pharmacy. Years ago, pharmacists used to make drugs. You know,
Yeah.
years ago, they used to sit there on their counter and mix creams and all this. This is just a very evolutionary way. Like they've taken that and made it into a superior uh, format to where we can now use all kinds of things that may not be available or
Yeah.
discontinued. So,
And how I see it is big pharma is trying to crush their competition, not due
one,
to, yeah, not due to legitimate reasons, but because you're a threat to them.
yes.
That's all it is. And if I understand it, because I went to all these PCCA conferences and talks, so I learned a lot about it. Your variance is smaller than big pharma. Like how far off you can be from your measurements, isn't that correct?
It's very strict.
Yeah.
Very
Yeah.
strict. I mean, you have to follow, I mean, the computer systems are amazing. You have to scan the drug, you have to measure it. The computer captures the measurement. I mean, this is science.
Yeah.
This is
Yeah.
not, somebody that's working in their kitchen, with a kitchen scale and a
Yeah.
kitchen made mixer. This
Yeah.
is, if you walked into it, you'd be like, wow, this is
Yeah.
amazing. Yeah.
And see, and big pharma tries to frame compounding pharmacists as what you're talking about, people mixing stuff up in their kitchen. That's
Yep.
how they try to frame it to scare people from using compounding pharmacies. So I want my patients and anybody to know that I'm using a compounding pharmacy because it's more accurate, it's better, and for things like progesterone, I can ask them to make it slow release.
Yes.
If you get it straight from the pharmacy, actually, isn't Prometrium supposed to be like a every 4 to 6 hour drug?
Well, when you think about it, it's immediate release. And
Yeah,
so it's I don't know the half-life, but it's very
yeah,
short. And
yeah,
and some of these women need the progesterone to last longer. You
exactly.
know, I mean,
Hmm.
yeah. And
I use. Go ahead.
yeah, and what baffles me is that prometrium doctors recommend it vaginally, and it has a hard shell on the outside. When we can make it in a
Yeah.
meltable base. And listen,
Right.
these things are tested. Like this is real. This
Yeah.
is legitimate. And
Yeah.
and like you said, pharma is trying to say that, we're doing these things in a inaccurate way, and it is not true.
Yeah. It's all media. Again, they're trying to crush the competition, and you guys are fighting every day and in all legislatures across the country trying to maintain their ability to practice good scientific pharmacology.
That's correct.
It's a shame, but
But
money. Yeah, go
especially,
ahead.
I'm sorry,
Hmm.
especially in the hormone world.
Yeah.
Okay. I
Yeah.
mean, it is a constant, especially with testosterone. As
Yeah.
testosterone
Mm,
has not been available for women, or
yeah.
is off-label use. So there's not a pharmaceutical product, but they're trying to bring one.
Yeah.
They're working
Yeah.
on it
Yeah.
finally, but
Yeah.
but that doesn't mean that compounding is out.
Yeah.
It doesn't mean that we are doing something that's not good. We
Yeah.
are helping women with a product that's not available to them
Yeah.
right now.
And the reason why she has to frame it like that is because of the standard of care. And let me explain to you what, at least in medicine, this is the definition of standard of care. What are most physicians in your area doing? So it's not about science. It's really about what is everybody else doing. And whenever you do something outside of the norm, you get attacked, you get labeled a quack. People try and go. Now, patients don't go to the medical board or the pharmacy board. It's the doctors who feel threatened by the person, and then they go to the medical board and say this guy is functioning outside the standard of care. But to me, you want a doctor who's outside the standard of care, because most of the patients who come to me say, I've been to 10 doctors and they don't know what's wrong with me. And you're the first doctor who told me what was going on. So, yeah, man, do you have something to add to
Well,
that?
I will say
Mhm.
this. I won't get into it, but my health journey would not
Yeah.
have been solved without
Hmm.
seeing a functional medicine doctor in Virginia.
And you
Okay?
live where? And you
In
live where?
Louisiana. In Louisiana. I mean, it's crazy.
I
But
know.
but I had to do that.
Hmm.
And Louisiana's catching up. We have a few, but
Yeah.
functional medicine physicians. But I mean, at least we have A4M and IFM, which are,
Yeah.
institutes of functional medicine that are training physicians that want the education.
Yeah.
I feel like
Yeah.
some of them don't want it. They don't want to
Yeah.
learn something new.
It's too easy to just stay in that routine. Now, when I get into one of those routines, I get stagnant. I get frustrated, and that's kind of why I'm doing this. Because, man, I mean, I did this for 10 years straight, and it burned me out.
Hmm.
I actually, I had to stop. I was at an A4M meeting. I don't know if I told you this story. I was at A4M meeting, and I was still delivering babies. I
Mm,
flew out to I flew
mm.
out to Las Vegas, and I was the headline. I mean, I was the morning speaker. I was usually the first speaker because I kind of created a lot of energy. I got things going.
Yeah.
But that morning, and I had been doing this for 10 years, so a lot of people had heard me before. And I got up on that stage and I looked at my slides. It was my hormone replacement by the book. I've done it 1,000 times. And it looked like someone had switched the slides on me. I mean, my mind went blank. And I sat up there. I just read the slides for about 30 minutes and I had to just say, I'm sorry. I gotta stop. I don't know what's wrong with me. People thought I had a stroke. And
Wow.
they called my wife and they got me on the plane. I went home and I did a cortisol test and it was flatline.
Oh,
And it took me 6 months to recover. I was sitting in the office, patients would be talking to me, and I could not comprehend what they were saying. It was bad. So, but anyway,
Wow.
but that taught me burnout, and I didn't do anything for about 4 or 5 years. And then I got into that rut. I was just going to the office. And then last year, I at when I was turning 65, I'll be 65 next month. I had to decide what I was going to do with the rest of my life. And I took all these mentorships and masterminds, and I am resurrected. It's
I love it.
Easter. Yeah, I'm resurrected. I'm ready. I'm ready to start this fight all over again, because I realized that there's a new generation of people who are going into menopause. I was doing this 25 years ago, so now the 25-year-olds are 50, like you. I don't want to tell your age. But
Next week. No, next
yes,
week. My 50th
right.
birthday.
So I met you in your 30s, and now you're here. So anyway, go ahead.
Yeah. So your story is my story, similar. I mean, I was ill for a while, and it took me a while to get back to where I am. But Dr. Taylor, when I left the pharmacy, people were looking for me.
Yeah.
Okay. And because they needed help. And
Yeah.
so it's like God is leading me to continue this journey. And I read all kinds of stuff now. It's not just about
Oh, me too.
menopause. I mean,
Yeah.
it's about brain health, Alzheimer's, supplements. I mean, as
Yeah.
well as I do, it's not just about menopause. I mean, menopause
It's
is a
not.
big thing,
Yeah.
but you can't fix it with one thing. You have
Yeah.
to look at the whole picture. Functional
Yeah.
medicine does that.
Yeah. You have to look at the gut. You have to
The
look at
gut.
heart. You have to look at all that stuff. So I want to get. We usually take a break in about 3 minutes, but I want to show why we're on this fight. Why we
Yes.
get resurrected? Why did
Yes.
we get motivated
Yes.
again? Because of this. Now you can show that slide. All right. Here's the problem. Doctors they don't know what to do. There's no guidelines for this. And the reason why is this North American Menopause Society. I actually hate them. Okay. I hate them because they're so unscientific. Now, they have tried to have guidelines, but over here, they have retired their position 13 times, and they still don't have a reasonable position on menopause. And the only position you have to have is do the right test, look at the relationship between estrogen and progesterone, correct the balance, look at cortisol. And the key is you have to have data. See, nowhere in any of their positions do they talk about how to test. Despite changing recommendations on treatment, there's still no consistent protocol for hormone testing before or during treatment. So, when I was a resident, we gave everybody Premarin and Provera. And the only time we told them to stop was when they had a positive mammogram. So that was our only measuring stick. We couldn't see that trouble was brewing. We just had to wait till the trouble showed up. And so that was just guesswork medicine. And 25, 30 years later, they're still guessing.
That is not scientific. That's not science.
It's not. And I think in all scientific research or medicine research, women and minorities get ignored. And if it's a woman problem or a minority problem, who cares? Okay, it really is.
You're right.
Yeah, it's and so the only way we're going to change this, I talk about movements start from the bottom up. This is my example, is that when I was doing OB, there was still like the waiting room, and the mother would go in, and it was like a real sterile procedure. And women, baby boomers, refused to have their babies like that. And now they have these labor and delivery rooms that look like rooms in the Ritz-Carlton. Am I right?
Women are demanding. They're demanding.
Exactly. And doctors didn't make that change. It was women. And I'm relying on women. And the baby boomers have moved on past this. Now, I don't know what the generation is after the baby boomers who's going into this, but I'm trying to give you the baby boomer spirit, the baby boomer spirit is that we reject authority. We don't allow the status quo to rule us. And what generation are you in, Mandy?
Uh,
Because you're not a baby boomer. I don't
I'm
know. I
not
don't
a
know what they call.
no, no. I don't know actually what you
Yeah,
call it, but almost
but you're
50. So
yeah.
Generation X.
Oh,
no,
I thank you.
I think that was before. I think that was after me. I don't
Yeah,
know. It
yeah.
was maybe so. I don't know what it's called.
I don't know what it's called, but
If you were born in the 70s, you're Gen X.
Okay, then there we go.
okay.
That's it.
So
Okay.
I'm at the end of the baby. I was born in 60. I think the baby boomers ended in 64. So I'm at the tail end of the baby boomers, but I still got enough spunk,
Oh
to keep
yeah.
us all. Yeah, I wasn't at the beginning of the baby boomers. So I'm more like Generation X than I am, the baby boomers. So hey, it's time for our little commercial, and then we're gonna get back and talk about what the legislature in California is trying to do, and then what the FDA is talking about. So we'll get back to that. All right. So we're gonna have a break.
We are going to a quick break, so stay with us as we explore the Ageless Blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
All right, we're back with our guest, Dr. Mandi Romero. Hey, Rebel, do we have any questions, or can we keep going?
Yes, actually, you have, let me see.
Uh-oh.
You have a question. Do you
Okay.
offer functional medicine hormonal training for physicians?
I'm glad you asked that question. I just in Ageless Blueprint. I started a course. It's Ageless Blueprint for health professionals. But the first thing we're going to start talking about is hormones. So yes, I do have that course. You can go to agelessblueprint.com. school.com/ageless, what you see right there. And I have a course for healthcare professionals. I definitely do. So great question. And I didn't set you up for that. So, but go ahead. Do we have another question?
Nope. We're
Okay,
good.
great.
People are
All right.
taking it in. They need to know knowledge.
Okay. So what got us started on this is what got me started in thinking about asking Dr. Romero to come on is, can we show the slide number 2 that I have there? All right. So California is trying to fix this medical education. They're trying to demand that these residents get educated, because they did a survey and only 9% of the outgoing residents felt like that they knew how to treat menopause. I didn't say 90%. I said 9%. And even those 9%, I would be surprised if they really know what they're doing. I would be very surprised.
I'm wondering what they know.
Yeah.
Why are they more confident than the rest?
Yeah. What do they know?
What do they know?
And I hope they're not following the North American Menopause Society's recommendations, because they still don't know. And that's what this legislature is trying to get them to do, is to try to get them to be educated on the North American Menopause Society's recommendations, which can change in a heartbeat, and still it's not based on any credible diagnostic information. It's only based on symptoms and on guessing. So that's the first thing, is why 30 years after we started talking about this, Mandi, is only 9% of the doctors thinking that they can do it.
I I can't understand it, but I think it's exactly what you said. It's the information they're receiving in school is nowhere near what they need to get. I mean, I'm gonna tell you this, and you may agree, maybe not. I think
Mhm.
OBGYN should be split. I think you should have obstetrics and
Oh yeah,
gynecology because you
yeah.
cannot get a woman's history and what she needs in 7 minutes.
No,
I mean, and
no.
that's why
Yeah.
you're a functional medicine physician now, because
Yes.
you can spend an hour. And that's how much
Yes.
I spend. I spend an hour or
Yes.
more. But to
Yeah.
get everything, because they need education on supplements, they need to know what menopause is, they need to
Yeah.
understand what they're taking, and they need time for questions,
Yeah.
you know?
That's one of the reasons why I did this platform, so that I could uh, have something that people could go back and reference, because you spend that hour with the patient and then they still have questions. They still want to go back and
Mhm.
learn. So that is the reason, because I had patients who I would have seen 3, 4 years ago. We tested them. We have their hormones great. They're feeling good now. So then they say, you know, I can go to my regular doctor and only I have to pay this copay. So I'm just going to go to him. So now it's 2 or 3 years later, and now the doctor is saying, "Oh no, you shouldn't be doing this. You should do that." And then they
Mhm.
would come to me and say, "Dr. Taylor, I went to this other doctor," and I would say, "Why did you? I thought you understood this." And I figured out I've got to have something that lives on after the office visit, and even after I'm gone. When you get to my age, you start really understanding that you're not going to live forever. Okay,
Yeah.
and so you start to really understand it, and I think it happens right around 50, Mandy.
Well, maybe that's what's happening to me.
Yeah.
I realize that I'm repeating the same thing over and
Mhm.
over. And so
Yep.
I'm writing a book, and my
Right.
book is not on menopause. Believe it
Yeah.
or not. I mean, maybe one day, but it's on stress.
Uh, a perfect gateway, because that's what set me down at that A4M meeting, was stress. And you're talking about talking to a patient long enough.
Yep.
I really believe that when I see a new patient, it takes 20 minutes for me to establish a rapport with that patient. They
Hmm.
tell me what's really wrong with them. And when they really tell me, they will tell me about how the divorce, was such a terrible divorce, even though it was 10 or 15 years ago. It's still, that stress still
Hmm.
lingers. They're going to tell you about their kids and how their kids are struggling in school, whatever. They're going to, and how they're taking care of their parents and how that's such a stress, and they feel it. But it's 20 minutes before they're really going to tell you that.
Yep.
That's why you have to spend that time with them, because I used to say this all the time in my stress lecture, and I say it now. 75 to 90% of all visits to primary care physicians are for stress related complaints or disorders. I, and so
Totally
I,
agree.
that was back in 2001. Now the rate, I'm sure the percentage is 95 to 100% of every visit, because
I,
the world
yeah,
is a lot more chaotic now than it was in 2001 when that study came out. So,
that's right. Hmm.
so stress is the issue, Mandy.
And we have to make time for that. Like,
Yeah,
we can't just go in there and say, oh, you're menopausal. Let's give you some estrogen, some progesterone, and go about your day. Because,
yeah,
I mean, you may have 1% or less that they have a great life. Stress is not an issue,
yeah, yeah.
but that's not reality.
It doesn't happen. I just did a like a YouTube video talking about the epidemic, the menopausal education crisis epidemic, because I do these tests and you do them all the time.
Hmm.
I am hard pressed to remember whenever an initial saliva test came back normal.
Oh, I don't think I've ever had one.
That's-
I mean, I'm gonna be honest.
yeah,
Because that's why they're coming to us,
I know.
because they're looking for answers and they're
Yes.
not getting them.
Yeah.
They're
I
not getting
can't I
them.
can't remember. I mean, I really can't remember somebody who walked in complaining of any type of symptom like that. That if I do the saliva test, that it doesn't come back showing me something. And I believe that that's That's 50%. Well, 50% of the treatment is when the patient comes in and you talk to them and you can explain to them why this is happening to them. That's 50% of the battle, because they've been to all these docs and they think they have some undiagnosable disease that's
Right.
going to kill them. And then when you tell them, no, it's stress, and I can show you that it's stress and it's your hormones, and
Hmm.
that gives them so much relief. And then when you show them on a piece of paper that your cortisol should be up here and it's down there, and your estrogen should be here and it's down, and it's just such a sigh of relief. It's such a stress reliever for the patient. And you can see it in their eyes when you
It
talk
get,
to them.
it gives them hope. And I think
Exactly.
a lot of these women come and they're hopeless because the answer,
Yes.
they're not getting answers. They're just getting the
Yep.
runaround or what have you.
Yeah.
And they're searching,
Yeah.
and a lot of them want to get better.
They all
That's
want
a
to get
battle
better.
too. That's a battle too. Some people don't want to get better, but the
Yeah.
majority do.
Yeah. Because what you do is cash based. I mean, when people put
Yes.
money on the line, you
Mhm.
know that they're serious.
Yes.
And that's how you have to do it. I'm sorry, but this information is valuable. And I'm sorry, I mean, you have to pay for it. That's just the way it is. If I
Yeah.
create value, it's supposed to be, and that's just the way it is. Okay. So
Yes.
let's go to this last slide. This is from the
Yes.
FDA. We'll go to this and then we'll be finished. All right. So this is recent. I mean, this was just like last week. I saw it on Doximetry.
Yes.
Said
Yes.
the FDA commissioner stirs debate over hormone therapy for menopause. And I'm asking, why are we still debating this? That's my issue. Is have the last 25 years been in vain? That we've been trying to do this, but hey, I'm up for the fight.
Yep.
I will keep going. That's why I'm doing the Ageless Blueprint. I'm trying to stay ageless. I tell people I want to be the Colonel Sanders of hormone replacement. He started a new venture at age 65. I'll be 65 next month. So I got 1 year. I have a year start on Colonel Sanders. And I say I want to be the LeBron James and the Tom Brady of medicine.
I
I want
agree.
to, I want to do it. If I'm 80 years old or 90 years old, I still want to be talking about saliva testing and balancing hormones. And unfortunately, it's probably still going to take that long. Maybe AI will do it.
Maybe
Okay.
so.
Yeah.
Have hope.
I'm gonna try and feed Chat GPT, everything I know about saliva testing, and see if I can't overwhelm AI.
I
Because
think that'd be wonderful. I
well,
mean,
they say AI is going to replace doctors.
oh,
So
oh,
well, yeah, you
I
just
don't
have
know
to have
about.
well, you just have to have the right avatar or whatever. Maybe we'll be dead and gone by that time. At least I
Probably
will.
so.
You're younger than me. You're younger than me. But so we're going to wrap this up, and I want to thank Dr. Give us your parting. Just give us a little parting statement that you want women to know. Because this is to try and expand our reach. You're in Lafayette, Louisiana.
Yes.
I'm in Atlanta, Georgia. But hopefully, people all over the world might see this. People 20 years from now might see this. So just leave a little parting little word here.
Okay. So I realized when I had the hysterectomy that I really understood what women went through, and we're being lied to. We were being lied to. And I started practicing in 1999. And then 2002 came up, and that was the Women Health Initiative. And
Yeah.
it was such a mess. And
Yeah.
women are still referencing that. I mean, it was such an awful time. And we were fighting an uphill battle at the time.
Yeah.
Okay.
Yeah.
But now that I feel like people are empowered to be well, they want
Yeah.
more than just living a long life. They want longevity.
Yes.
And we need hormones to aid us in longevity. And so
Yeah.
my mission's changed a little bit. I mean, of course, I want to touch every patient, see as many patients as I can. But I think educating on a bigger platform like this, and then writing a book. My book is going to be
Yeah.
on stress, hopefully out at the end of the year. But but I feel like my life's work, you know, can help women, empower them, teach them what they need to know. And then they can challenge their physicians to say, hey, what about this? What about this? Because
Yeah.
you're exactly right. It has to come from the patient. And I've learned that a
Yeah.
long time ago. But as a pharmacist, it's a little more difficult. I mean, you can write the scripts. I have to
Yeah.
ask, but
Yeah.
I support the physician, so, and the patient.
Yeah.
So my mission is to educate women, to empower them, and to help them with the rest of their life so they
Yeah.
can live a long life.
And you know, women are very persuasive. You know, I've been married 39 years. You know, so women are very persuasive, and you need to use that power of persuasion, and you need to use that women's intuition. You know,
Yes,
most women, they know when they're being lied to. They, you know, believe me, I've learned that in 39
they can
years
sense it.
is that, yeah, it's no need of me trying to lie to my wife. Okay. And what I try to do, you know, I had this lecture called I Can Make You an Honorary Gynecologist.
Yes, I
Yeah, you
remember
remember
it.
that one? Yeah.
Oh yeah.
Now that's actually on my Ageless blueprint. And what I was known for back then, you know, I kind of want a lot of my patients, they don't know I had a former life where I was speaking all over the world and all this stuff. So this will educate my patients. I had one patient that had been with me for 2 or 3 years, and I showed her my book. She said, "Oh, I didn't know you wrote a book." I'm like, "What?" And so that's one other reason why I want you here to say I had a former life where
Oh
I
yeah.
was a pretty good speaker, and you know, so I taught this a long time ago. But the other thing that I was known for back in my previous life as a speaker was my caterpillar story,
Oh, that's
and
my
I still
favorite. That was my favorite.
I haven't used that here, but let me I'm a part
Yeah.
with the caterpillar
Yes.
story so that
Yes.
I can get that out. So I used to talk about a processionary caterpillar. And processionary caterpillars, they will pick a leader, and then the rest of the caterpillars will follow behind them. And that works great as long as the processionary caterpillar is doing what processionary caterpillars are supposed to do. If they go to the caterpillar park and play, and they go to the caterpillar restaurant and eat, they go to the caterpillar, you know, amusement park, they do all the caterpillar things and they live a long, happy, healthy life. Now, if you allow outside influences to push those caterpillars, let's say, you know, they push those caterpillars where the head caterpillar starts to look and see the tail caterpillar, it will think that there's been a coup or a recall election and there's a new leader. And so it says, hey, I'm a good caterpillar citizen. I'm going to follow this leader. And they'll go around and around in circles until the caterpillars die, each thinking that the other caterpillar is leading. And so the key is this is what is happening in medicine. We are following a caterpillar leader that's not following caterpillar instincts. Our caterpillar instincts should be following science, but we've been manipulated by the pharmacies, by the pharmaceutical industry, and by the media that we are following the wrong leader. And so the only way you can figure out, because when you're in this caterpillar line, you don't realize it. The only way you can realize it, you have to get out of line and look back and say, wow, I
Yes.
was in a caterpillar line, but you don't see it. So that's why I say you don't want to be a caterpillar. You have to get out of line. And I had to get out of line with my OBGYN training. I had to get out of line with a lot of the other information that I had been programmed. You have to get out of line, and then you have to look back and say, what was I doing? What was I thinking? Where was I going? And you have to get out of line and you have to follow. And I talk about women, their intuition is their caterpillar instincts. And with physicians, the caterpillar instinct is I'm going to follow science, and I don't care who comes against me. I am going to do what science tells me to do. So that's my little caterpillar story. This
I
is
love
the
that
end of this
story. It's a great
podcast.
story.
So don't be a caterpillar, get out of line. Mandi, thank you so much. I'm going to have you back. I think this is a good little
It was an
combination.
honor.
Yeah, it's a good little combination to
I
see
love
both
it.
sides of a story. So thank you again, and we'll see you guys next
You're
week.
welcome.
All right. Bye-bye.
Yes.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discover the ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.